Welcome to Ulosca channel. Access all nursing practice questions. HESI A2 Vocabulary Practice Questions with Answers.
Question 1. What is the best definition of the word abstain? A. To hold back from something voluntarily. B. To criticize harshly. C. To speak clearly. D. To encourage. Which one is the correct answer? The correct answer is A. To hold back from something voluntarily. Explanation. Abstain means to deliberately avoid doing something, often because it is harmful or inappropriate, such as abstaining from alcohol or unhealthy food. Question 2. What does benevolent most nearly mean? A. Generous. B. Angry. C. Sneaky. D. Loud. Which one is the correct answer? The correct answer is A. Generous. Explanation. Benevolent refers to someone who is kind-hearted, charitable, or helpful. It is often used to describe a person or act that benefits others. Question 3. What is the meaning of compensatory in a medical context? A. Making up for loss. B. Causing damage. C. Relating to digestion. D. Reducing pain. Which one is the correct answer? The correct answer is A. Making up for loss. Explanation. Compensatory describes actions that counterbalance or make up for a deficit. For example, the body may increase heart rate to compensate for low blood pressure. Question 4. What does contingent mean? A. Inevitable. B. Dependent on something else. C. Random. D. Immediate. Which one is the correct answer? The correct answer is B. Dependent on something else. Explanation. Contingent describes a situation that depends on specific conditions or factors. In healthcare, a patient's treatment plan may be contingent upon test results. Question 5. What does exacerbate mean? A. To soothe. B. To improve slightly. C. To make worse. D. To eliminate. Which one is the correct answer? The correct answer is C. To make worse. Explanation. Exacerbate means to intensify or worsen a condition. For instance, stress can exacerbate chronic pain or anxiety. Question 6. Choose the correct meaning of flushed in a medical setting. A. Lying flat. B. Pale. C. Reddened appearance. D. Cold and clammy. Which one is the correct answer? The correct answer is C. Reddened appearance. Explanation. Flushed refers to skin that becomes red due to increased blood flow, commonly seen during fever, heat exposure, or emotional stress. Question 7. What does insidious mean? A. Obvious. B. Gradual and harmful. C. Short and intense. D. Loud and clear. Which one is the correct answer? The correct answer is B. Gradual and harmful. Explanation. Insidious describes something that develops slowly and subtly, but is harmful. An insidious infection may not show symptoms right away, making it dangerous. Question 8. What does lethargic mean? A. Very thirsty. B. Easily startled. C. Drowsy and sluggish. D. Confused and anxious. Which one is the correct answer? The correct answer is C. Drowsy and sluggish. Explanation. Lethargic is used when a person appears slow, tired, or lacking energy, often due to illness, medication, or fatigue. It indicates reduced responsiveness. Question 9. What is the best synonym for occluded? A. Opened. B. Blocked. C. Cleansed. D. Inflamed. Which one is the correct answer? The correct answer is B. Blocked. Explanation. Occluded means blocked or obstructed. In medicine, this can refer to a blood vessel that is blocked, preventing normal circulation. Question 10. What does precipitous mean in a clinical situation? A. Sudden and dramatic. B. Controlled. C. Gradual. D. Careful. Which one is the correct answer? The correct answer is A. Sudden and dramatic. Explanation. Precipitous refers to something that occurs very suddenly and often with little warning, such as a precipitous drop in heart rate or blood pressure, which may signal a critical event.
Thank you for watching. For more practice exam questions, subscribe to our website at www.ulosca.com.